We are recording now.
Great. Hi, everyone, and welcome to the Moz Lobby Day 2016 webinar. My name's Audrey Levine. I'm the Legislative and Policy Chair for the Midwives Association of Washington State. And for those of you who have never participated in Lobby Day before, we hope that this webinar will give you an idea of what to expect and will help you feel prepared for your day at the Capitol. In order for us to have the best possible sound quality for the webinar, I'd like to remind the presenters and other webinar participants to please mute yourselves when you're not speaking. And then don't forget to unmute yourself when it's your turn to speak. So just a quick preview of what we're going to cover in the next hour. First, Kristin Efland, who's a midwife and a member of the Moz Legislative and Policy Committee, will start us off by sharing why it's important to show up on Lobby Day. Then Moz lobbyist Amber Ulvanis will give us a primer on lobbying and how best to get our message across. After that, Kerry from the Legislative and Policy Office at Bastyr University will educate us in the art of the elevator speech. And then I'll be walking us through Moz's legislative agenda for 2016. And then finally, Moz Legislative Liaison Sasha Henry will cover the logistical details of Lobby Day. We anticipate that there will be about 5 minutes at the end of the webinar for questions, at least 5 minutes. So please make a note of anything you might want to have more information about, and we'll do our best to answer your questions. And with that, let's get started. Kristin.
Hi there, my name is Kristin Efland, and I'm a licensed and certified professional midwife across the Cascade Mountains here in Central Washington. I'm also on the Legislative and Health Policy Committee. I'm also fighting off a cold, so please excuse me if I'm a little hoarse or if I cough today. Otherwise, I'm excited to spend a few minutes with you today as we prepare for Moz's Lobby Day in Olympia next week on Thursday, February 11th, 2016. Today, I'd like to start us off with the great toddler question, why? Why do Washington midwives travel to Olympia to spend the day there educating our elected officials once a year? Next slide, please. I'd love to share the answer with you because it's what I love about lobbying, interacting with the members who represent the legislative branch of our democracy. This work is filled with potential and opportunity. I would venture to bet that most of us entered the profession of midwifery for more than one reason. We wanted to be midwives, but I believe that most of us also wanted to affect change, to change the culture of pregnancy and childbirth for all pregnant persons and their families, who we hope will also join us at Lobby Day. This is no small charge, but your annual participation in Lobby Day, whether you're a midwife, a consumer, a family member, a student, or an apprentice, can help bring about the change you wish to see, especially on a policy level. Changes to our profession, including increased access to the profession, which also includes the affordability of practicing in Washington. Oh, there's my son. He's on the way upstairs with my husband. Sorry. Maybe I should have used my headphones. It's also possible to bring about changes to the wider culture. Perhaps you can tell, after spending just a few minutes with me, that I am an optimist. In reality, we know that change is often more slow and incremental than we want it to be. But when you look over time and see what we have been able to accomplish historically, you can begin to see the cumulative effect of our ability to influence policy. Don't underestimate the potential of your annual participation and engagement. Next slide, please. Now that we have an answer to our toddler question, why, we can move on to the type of question we might get from our teenagers. What has lobbying done for me? Even if you have never participated in Lobby Day or never contacted your representatives to advocate on your own behalf or on the behalf of women, babies, and families, Moz has been organizing a midwife Lobby Day in the state capitol for decades. And before Moz officially existed, midwives, consumers, and student midwives worked on our behalf, educating legislators and effecting policy changes from which we and our clients still benefit today. Much of what you think about as the defining characteristics of practicing licensed midwifery here in Washington was won through advocacy. The work accomplished by those that have gone before us has been awesome, but there is more to be done. Next slide, please. There is much more potential for us to actualize. To reach this potential, we need your participation and that of your colleagues. We hope that more of us can make it to Olympia in person each year. And for those who can't make it, we hope you will contact your representatives on your own time. This slide lists some examples of the potential influence we could have. I am passionate about getting more midwives, consumers, apprentices, and students to Lobby Day each year. I've always imagined that one reason we have had such low participation some years by practicing midwives might be due to a lack of information. This webinar was designed to help you feel more prepared and informed, and to help you see why your participation is vital. We have organized this webinar today to help you feel ready to come to Lobby Day and join a team as we approach our lawmakers with the goal of effecting positive policy changes for our profession and the families we serve. Next slide, please. It is important to realize that it is more enjoyable for your legislators to meet with you and get to know you, their constituents, the people whom they came to Olympia to represent and serve, than to always meet with professional lobbyists whom they see every day and whom they know are hired to represent various interests. While the role of professional lobbying is also critical to our legislative successes, you as a constituent have a special and unique role to play. Next slide, please. While you may not know a lot about lobbying, you do know a lot about midwifery. You are the expert in the room when it comes to midwifery and how the midwifery model of care affects moms, babies, and families. You are there to make our issues personal and help your legislator see your concerns and hopes through your eyes. We are going to go over some facts and figures and details of our legislative agenda here today, but you do not need to memorize everything. Your role at Lobby Day is to be yourself and convey your personal message as it relates to our legislative agenda. Don't worry if you can't remember all the details or can't answer a question. That is what we hire our lobbyist Amber for, and she can always be back in touch with anyone you meet who needs more information. Next slide, please. Stay tuned for lots more tips and information. Rest assured you do not have to visit your representatives on your own. We travel to visit our legislators in teams. But I am concluding with this slide nonetheless, which contains some ideas for things you can say when meeting with a legislator when you don't know what else to say or do. And now I would like to introduce our amazing lobbyist, Amber Albanese. She has been doing great work for Moz for several years now, following the birth of her second child with her midwife, Audrey.
Amber, you need to unmute yourself.
I'm sorry about that. I thought that I did. Hello, everyone. My name is Amber Albanese, and I'm thrilled to be your lobbyist here in Olympia. I strive each day to channel your voices and make you heard here in Olympia. Could I go on to the next slide, please? So I've got a few tips for making the most of your time that you do get with your legislators, and some tips on being an effective lobbyist. It's wonderful that you are here. I think that in so many ways, citizen lobbyists can be so effective and even more effective than we can on the ground a lot of times, because you're there to make a personal connection with your representatives. So when you get to see them, start by thanking them for their time. It's probably going to be a very brief meeting. So, working through these pieces, you got to stay on pace. So introduce each attendee that's in the group, and be sure to identify if you are a constituent of theirs. Tell them why you are there to see them, and use your talking points to convey your message for the day. If it's always great to get a commitment from them. A legislator would rather not commit to anything. They would love to be able to just say, thanks for coming, I appreciate your presentation. But if we have a request of them, don't be afraid to ask for their commitment one way or the other, and then record it so we can keep track of that information. And then be sure to thank them for their time and move along. Next slide. So I have a few more tips on lobbying and conveying your message. Be accurate. I'm thinking now that, what I mean by that is that being true to yourself more than actually knowing all of the particular data points or very specific things that we may be wanting to convey. Really, the most important thing is for you to make a connection with your legislator and maybe come up with something that is specific to your local area that they can connect to. Make your message brief and concise, and always be courteous. The legislative assistants that will admit you to the office are really the gatekeepers. So it's important to get in and out efficiently. And even if you are speaking with a member that has an opposing viewpoint, of course, it's important to always be courteous. These are relationships that matter over the long term. Next slide. So a couple of other tips. Researching your legislators can also be very helpful. If you go to the legislative website and look up your members, they all include biographical information. And it's nice to know going in a couple things about them, if they're parents, what type of job that they have, and what their specific community is. It can be helpful in making a connection with them. And as I have stated before, just speaking clearly and being a good listener. I think it's easy to get carried away with our talking points, but it's important to leave a little bit of space for the legislator to comment or ask questions of their own. And then lastly, remember to be patient and flexible when you lobby. Schedules down here they get backed up, or you have to see a member on the floor instead of in their office. So just expect that things aren't going to go smoothly, and that will help you out a lot. Next slide. So I'm very much looking forward to seeing all of you here in Olympia for Lobby Day. I would say dress business casual and wear comfy shoes, because we're going to spend some time on the marble. And now we are going to hear more about perfecting your message for Lobby Day.
Hello, I'm Heather Kerry, Director of Bastyr University's Center for Health Policy and Leadership. Thank you, Amber. That was very helpful. I'm also an enthusiastic supporter and advocate for the midwifery profession. Today, I bring you the art of the elevator speech, how to deliver the perfect pitch. So what is an elevator speech? The story goes that in Hollywood, scriptwriters would pitch their scripts to movie directors while they were riding in the elevator together. The directors were sort of trapped and would have to listen for at least the 30 seconds of the elevator ride. Therefore, the pitch would have to be short and to the point. The idea of the elevator speech is to spark the interest of the listener, so they will want to hear more about what you are pitching and have a clear understanding of what your passion is all about. You can use this to tell people about your work and/or issues you are passionate about. As Amber spoke about, legislators want to hear from you, but they are busy. The elevator speech will give you an opportunity to convey your message clearly and quickly. Why do we need one? We need an elevator speech to develop a clear message that we can convey with confidence and use when needed, during lobby day, at conferences, and at other professional and personal events. Having an effective elevator speech can assist us in recruiting for our cause. How do we create an elevator speech? We start by identifying the objective. What are we trying to accomplish with this pitch? After identifying the objective, think about how to explain most effectively what you are trying to pitch. For example, your idea or your profession. Gearing the pitch for the intended audience is important. You may have a few elevator speeches up your sleeve that can be used for different audiences. You can also engage your audience with a question. For example, with legislators, you might ask a question to them concerning the needs of the people they are representing. This will help engage them and pique their interest as well. It's important to connect to your why. When you connect to your why, your enthusiasm and passion will shine through, and the listener will want to know more about what you are pitching. For those of you who are midwives, connecting to the why will involve the work you do, and this will be important. For the supporters and advocates who are joining the midwifery community for Lobby Day, connect to why this is important to you and your family and the greater community. Your passion will shine through when you connect to the why. So we've included a template here to get you started. By filling in the blanks, you will be on your way to creating an effective and compelling pitch. Finally, I'll leave you with an example. Hello, my name is Heather Kerry, and I'm here today to wholeheartedly support the midwifery profession. I know as a health policy professional and past consumer of midwifery care that midwives positively contribute to the health of individuals and our communities by lovingly and skillfully bringing humans into the world. And of course, I always get teary-eyed when I say things like that. And my why is how a person comes into this world will impact that person and the person's family for generations. We have a responsibility to welcome newborns and with loving experience care. So now Audrey will go over the legislative agenda. Thank you for the work you are doing, and I look forward to seeing you in Olympia. Here's Audrey.
Thanks so much, Heather. That was beautiful. So I want to just start by saying, because I think I forgot to say at the very beginning of the webinar, that Lobby Day for the midwives is going to be next Thursday, February 11th in Olympia. And so I just want to make sure that everybody has that date on their calendar. So as I said at the beginning, my name's Audrey Levine. I'm the Legislative and Policy Chair for the Midwives Association, and I've been in that role for about 15 years now. I'm going to share with you the MAWS legislative agenda for 2016 and give you a little background and context for the conversations we'll be having with legislators on Lobby Day. Please do remember, as Kristin mentioned, that you'll be meeting with members in teams, and each team has a team leader. So don't feel like you have to come with a deep understanding of every aspect of our legislative agenda. Just showing up sends a big message to lawmakers that midwifery matters. Next slide, please. This sheet concisely conveys our legislative agenda, and we'll be bringing a copy to each of our appointments and leaving it with legislators and their staff. We will also have specific talking points available at our morning briefing. Next slide, please. We have 4 main goals this year. The first is to educate legislators about the health benefits and the cost effectiveness of licensed midwifery care. And many of the folks that we'll be meeting with are well aware of midwives and the value that we bring. Others are less familiar and may need a little background, which I'll share with you in a moment. Our second goal is to express our appreciation for the passage of House Bill 1773 in 2014 and to let legislators know the incredible impact that this legislation has had on our profession. We will also be specifically requesting support for a budget proviso that would direct the Healthcare Authority to review the Medicaid reimbursement rate for the birth center facility fee. And lastly, we'll be asking legislators to support the Pregnant Workers Fairness Act. Next slide, please. So one really pithy shorthand way to talk about the benefits of midwifery care is to mention that it aligns perfectly with the triple aim. The triple aim refers to a framework introduced by the Institute for Health Improvement for optimizing health system performance. And according to this framework, innovations in healthcare are needed that simultaneously achieve these three goals. The goal of improving patient experiences, both quality and satisfaction, improving population health, and reducing healthcare costs. You can certainly mention in your appointments that, in other developed countries, midwifery care is the default, right? All pregnant women receive care from midwives and only see a doctor when they have a medical condition that warrants it. And you can certainly also encourage legislators to go to the MAWS website and look in the legislative e-packet where we've compiled lots of resources. And this is great for you to check out too, to look at the e-packet. Among the things we have in there are the 2014 Lancet series on midwifery and the NICE guidelines from the UK that encourage low-risk pregnant women to consider giving birth at home, both to improve outcomes and to lower healthcare costs. You can also feel free to mention that Dr. Jeff Thompson, who was the former chief medical officer for Medicaid in Washington, has called licensed midwifery best in class care. Next slide, please. There are lots and lots of well-done risk-adjusted studies showing that midwifery care and community-based birth are safe options for women with healthy, low-risk pregnancies and result in significantly lower C-section rates, as well as lower rates of other costly interventions like epidurals, and higher breastfeeding rates, both of which contribute to better long-term health. So again, you can encourage legislators to go to the MAWS website, look at our e-packet, as well as our resources page. Next slide, please. Typically, we get a pretty good number of midwifery consumers showing up on Lobby Day, which is great because then they can speak directly to their experiences of midwifery care. It is particularly compelling, as you can imagine, when the beneficiaries and not just the providers of midwifery care speak to legislators. And of course, the cute babies, it certainly doesn't hurt to have them in visits with us. Next slide, please. Many of you are undoubtedly familiar with the 2007 cost-benefit analysis that the legislature commissioned. This study demonstrated that licensed midwifery care confers savings to the state of Washington of nearly $500,000 biennially. And it's worth noting that the study's estimate of cost savings was really conservative. It only considered avoided C-sections, so it didn't factor into the equation facility fees and expensive routine hospital interventions like epidurals. This cost-benefit analysis is the main reason that we've been able to keep the midwifery licensing fee capped at $525 a year, because we've demonstrated that the cost savings to the state of Washington conferred by licensed midwifery care make it worthwhile to subsidize our program. This study has also been used nationally by NACPM, which is the National Association of Certified Professional Midwives, and for some this study has been used to persuade legislators at the federal level and policymakers at the Center for Medicare and Medicaid Services of midwifery's potential cost savings to the entire U.S. healthcare system. Next slide, please. So I put this picture in so you all could see how fun Lobby Day is and see all those lovely smiling faces. This was the year that House Bill 1773 passed, and it was a very important milestone, as you'll see in a moment. Just a side note, we do try to get a picture of everybody on Lobby Day of all of our running around in the Capitol building, and Occasionally, we get a legislator to join us. You can see that's Representative Dawn Burrell in the middle of the photo. She's the one in red who looks like a legislator. Next slide, please. We want to be sure in our appointments to thank legislators for their support of House Bill 1773, which passed in 2014, and remind them that this bill directed the Department of Health to build a bridge between the requirements leading to the national credential of certified professional midwife and the requirements for licensure in Washington state. And since the passage of this bill, the number of licensed midwives in the state has increased by 25%, ensuring greater access to this high-quality, high-value care. The bill also mandated data collection for all licensed midwives in the state, and this will allow for comparisons of outcomes and value across birth settings. Next slide, please. Finally, in our meetings with legislators, we want to make the following requests. With regard to maintaining the licensing fee cap, there's not really a specific ask this year since there's already a budget proviso in the current biennial budget that caps our fee. However, student midwives in particular might want to thank legislators on Lobby Day since a higher fee would present a significant barrier for entry to practice. With regard to the budget proviso directing the Healthcare Authority to review the Medicaid reimbursement rate for the birth center facility fee, we're going to try to have a birth center owner in each of the teams who can speak directly to this issue and the need for an increase in the facility fee so that birth centers can remain viable. Lastly, we want to convey our support for House Bill 2307, Senate Bill 6149, which is the Pregnant Workers Fairness Act, and ask legislators for their support for this important bill that requires employers to make reasonable accommodations for their pregnant workers that have the potential to improve outcomes for moms and babies. Next slide, please. So that's it for me. I hope to see you all at Lobby Day next Thursday, February 11th. Please feel free to contact me with any questions about our legislative agenda this year. And thank you. And now I'll pass it over to Sasha.
Hi, everyone. My name's Sasha Henry. I help organize Lobby Day, and I'm also a consumer of midwifery services. I'm going to talk a little bit about Lobby Day logistics and parking. I'll start with directions. You can follow the directions on this slide. All the slides will be available after the webinar. Or if you're coming from North or South I-5, you can pretty much just follow the freeway signs right to the Capitol campus. You can also Google for directions, of course, or use the directions at the state capitol website. That's where I got these directions. Traffic is generally pretty smooth through Olympia, but if you're coming south on I-5, there can be unpredictable slowdowns at Joint Base Lewis-McChord. So you might want to Google the conditions or check the DOT website and find out if you need to leave extra time to get through if there's a slowdown there. Next slide, please. Our Lobby Day headquarters will be at the home of our fabulous lobbyist, Amber. You can leave your gear there during the day and come back and relax or have a snack if there's a gap between appointments. It's a very convenient spot because it's only about 2 blocks from the offices where we'll be meeting with the legislators. Even though it's very close, it still ends up being a lot of walking over the course of the day. So I echo Amber's recommendation to wear comfortable shoes. At the end of the day, it's only about a 5-minute walk from Amber's house over to Audrey's if you're staying for dinner. So you won't need to worry about moving your car or anything like that. Please don't forget to RSVP to me if you're staying for dinner, so I have an accurate count. We do start the briefing at 8 o'clock sharp in the morning at Amber's, and you don't want to miss the briefing. It's really important to get you all set up for a successful Lobby Day. So be sure to leave some extra time for parking. Right in Amber's neighborhood, there's a very limited amount of 2-hour parking. The parking is strictly enforced in that neighborhood during the legislative session. So let's talk about some other parking options. Next slide, please. The closest parking to Amber's house if you can't park right in front of her house, is the campus visitor parking. Again, these slides will be available after the webinar, or you can look up parking information on the legislative website to find out more about the on-campus parking. North and south diagonals and the visitors information lot are the closest to Amber's house. The visitors information lot you can find right on your way to the campus, the Capitol campus, if you're following directions from the freeway signs. Those lots do fill up quickly, but if you're there first thing in the morning, you might be able to get a good spot there. All the campus lots are $1.50 an hour from 8 to 5, and they also do take debit and credit cards as well as cash. Next slide please. The City of Olympia has on-street parking, ranging from 50 cents an hour to $1 an hour from 8 to 5. The meters nearest to the Capitol only take coins, so be aware of that. If you want free parking, and you don't mind walking a little ways, it's about a half a mile, you can park on the Deschutes Parkway on the west side of Capitol Lake. And there's a nice walking path that goes around the lake, and then there's a bit of a steep climb from the lake up to the Capitol campus. But if you don't mind leaving some extra time for that and you want free parking, that's a good way to go. Next slide, please. The City of Olympia operates a free shuttle, they call the Dash Shuttle, that runs from the Capitol campus through the downtown core and down to the farmers market. It runs about every 12 to 15 minutes from 7 in the morning to 6 in the evening. The farmers market is not open now, unfortunately, but you can park there for $1.50 an hour and then take the shuttle back up to the Capitol campus. The shuttle also goes to a couple of other pay lots that are $1.50 an hour that are, you could probably walk from them too, but if it's raining, it's nice to take the Dash Shuttle. Next slide, please. Depending on your team's schedule, you might have maybe 3/4 of an hour up to an hour and a half for lunch. You can bring a lunch, eat it on the Capitol campus if the weather's good. There are lots of nice places to sit and eat. Or you can come back to Amber's house for lunch. Lots of people do that. We'll have pizza available at Amber's. When you check in the morning, Amber's daughter and my daughters will be selling tickets for the pizza. $5 for 2 slices. And no, the kids can't take debit or credit cards. You have to bring cash for that. If you want to go out for lunch, there are a few restaurants on Capitol Way within just a couple blocks of the Capitol campus. Most of the restaurants are farther down, more like 9 or 10 blocks. So if you have time, you might want to take the Dash Shuttle for that. Or if the weather's nice, you can walk. Just make sure that your team has enough time to get there and back. If you don't have time to go somewhere during lunch, don't worry, you will have time after the appointments. Everybody will be done by 4, and some teams will be done a little earlier. So there's plenty of time to decompress before we meet for dinner at Audrey's at 6. There are places right nearby, just within a few blocks, to go for a cup of coffee or a glass of wine, or you can walk or take the Dash bus down to the main restaurant area if you want to have a cup of coffee or a glass of wine or something while you're waiting for dinner. Kerry Hall will also be hosting an open house at the Birth House in Olympia, if you would like to go to that before dinner. It's a short drive, probably not walkable. That would be a very long walk, but it's a very short drive, and we'll have directions to that at Lobby Day. If you have kids, it's a bit of a long day for them, so they might like to do something else either at lunch or before dinner. The public library is only about 6 blocks from the campus. It's open 11 till 7. We also have a very good children's museum. It would be a quite long walk to, or you can drive there. They're open 10 till 5. The nearest park with play equipment is about 12 blocks. That's pretty long to walk, but it's very close to the free Dash Shuttle line, so you could take the Dash Shuttle down there. If you have any other questions about logistics, please feel free to email me at moz.legislative.liaison@gmail.com, which is on the final in this presentation. And make sure you let me Make sure you let me know you're coming, so I can assure that we have an appointment with your legislator. And I look forward to seeing you all on Lobby Day. We have a few minutes now if anyone has questions about any part of this presentation. To make this go smoothly, we'd like you to type your questions in the message box. The message box is in the lower left-hand corner of your screen, the blue circle with the quote shape in it. And we'll take questions there. Thank you.
Okay, it looks like, can everyone hear me, hopefully? It looks like Deborah has RSVP'd on Eventbrite, and I think she probably means Wild Apricot. So Sasha, I think she wants you to know she's coming. Deborah Gleisner? I apologize if I'm pronouncing wrong. And if there's anything more you'd like to say, Deborah, you can unmute yourself. We just didn't want everybody trying to talk at the same time.
Yes, hi, this is Deborah. So I've also been making phone calls to a bunch of the birth center owners to try and get them interested in coming. And in my conversations with them, I've told them to RSVP using that Wild Apricot site. But I don't know how many of them actually are planning to come. So can you get their information from there?
I do get the RSVPs from the Wild Apricot site. So if you, sorry, I get feedback here. Can you guys hear that? If you RSVP'd on Wild Apricot, then I did get that. I do see yours, Deborah. I don't know who is a birth center owner from that information, however. So,
do you need me to give you any additional information? I mean, I did talk to several who said that either they were owners or they were owners and they were sending somebody else, so they were familiar with birth centers. But if they sent a student, I wouldn't necessarily know that either.
That's a good question. I guess if we're trying to get a birth center owner or the representative on each team, then it would be quite helpful for me to know that. If you would like to just drop me an email telling me birth center owners or the representatives that you know have RSVP'd, then I can match them up with their names. That would be quite helpful.
It would be, but I actually don't know any of that information other than maybe one and myself. But most of them, I left messages with the receptionist. So if they are planning to RSVP, they may have already done so, and we just don't know.
Okay. I guess we'll match them up on Lobby Day morning then, unless Audrey has a better idea.
Well, so I'm just wondering if, Deborah, if you can, am I able to go into Wild Apricot and be able to look at the list? Because I would probably know who's a birth center owner.
Well, I'm not involved in the Wild Apricot piece at all, so I don't even know how to go in there. Otherwise, I could perhaps do the same thing you could.
Okay. Sorry. I'm assuming that that Kristin Efland can help us figure out who has RSVP'd through the Wild Apricot site. So I'll find out, and then Sasha, I'll be in communication with you about, who is a birth center owner.
Actually, Audrey, I can send you the list of people who have RSVP'd. I have access to that as well. So I can send you the list, and then you can tell me who's an owner, if that works for you.
Perfect. Thank you.
And perhaps for next year, when we have people RSVP, we should maybe have a couple survey questions so we can try and match them up better.
That's a great suggestion. Thank you, Deborah. I'll make sure that Kristin Efland, who works with the Wild Apricot, hears that suggestion. Okay, there's Candace Safari. I don't know if there's anything you'd like to say. You typed in your address, so we'll make sure. I don't know, Sasha, if you got her RSVP, but she is hoping to let you know that she's coming. Jim McDermott, she said, is her representative. I don't know if there's anything else you need to say, Candace. No, she says no. So is there anyone else who has a question? Okay.
Thanks, Candace, for your message. That's lovely.
If there's anyone who can't figure out how to type in a message, but knows how to unmute yourself and would like to ask a question, I think it would be okay for you to try that. It's only a disaster if 10 of you try it once.
I'm curious, Candace, are you a midwifery consumer?
I think Candace might be gone. I don't see her on the list anymore.
She dropped off the call. Okay. Okay, it seems like people have asked the questions that they needed to ask. So, Kristin, if you want to do your last slide.
Sure. I can't see the slide, but somebody else might be able to. In conclusion, we want to encourage you to provide feedback to help make this webinar better for next year. Please direct any feedback to the emails, which you can hopefully see above, or which you can find on the Moz website. It's just the main emails for either Lobby Day or for Moz. And we want to thank you for joining us today. We hope to see you in Olympia on Thursday, February 11th, 2016, next week. Check your email or the Moz website for the most up-to-date information about Lobby Day as it approaches. I actually noticed our web mistress Maven is on right now, updating things, so it may be completely updated by the end of the day. And keep up the good work in the field. We hope to see you, if not this year, then next year.
Thanks, everybody.
Thank you.